So what is an anxiety disorder? Anxiety is a universal feeling, as we've explored, but when it starts to impact on your daily functioning and cause distress to you, then maybe it's moving into the area of an anxiety disorder. And I'll just explain a couple of them so that you've got a better understanding of what I'm talking about. Sometimes we can worry generally, and maybe we've been a worrier all our lives. We can worry about lots of little things. And if we're generally worrying a lot of the time and it's impacting on our daily functioning, perhaps stopping us from doing things that we want to do, getting in the way, then maybe it's an anxiety disorder. Panic. Most people at some stage will experience a panic episode. That's a discrete episode of quite acute, severe anxiety. And as I said, most people will experience one at some stage in their life. But when they become recurrent and when they start getting in the way of doing things, so say you've had a panic attack in the car and so you decide not to drive, or you've had a panic attack at the shops, so you avoid the shops, then that's heading into the anxiety disorder arena. You've probably all heard about phobias. There are phobias to hundreds of things. Common ones are things like spiders, snakes, small spaces, flying, lots of phobias. Again, they may not get in the way, but if you're not flying because of the flying phobia, or if you can't be in your house when there's a spider in your house, then maybe it's a specific phobia that needs some attention. Another very common one is social anxiety or social phobia. And that's fear of being embarrassed or negatively perceived by others. And that might stop you from doing a talk, from going to a function, from going to happy hour at work. So if that's getting in the way of you doing things that you need or want to do, it may come into the realm of a disorder. There are others, but I won't go into them here. If you think that you might have an anxiety disorder, the thing to do is to go and talk to someone who can assess that and help you understand what's going on. And that might be a GP or counsellor or psychologist. If you'd like more information, you can click on the link below and visit our website. You can share the link and you can make a comment if you want to.